So the first thing I'm gonna do is demonstrate how to strip a drain, okay? So what I like to do is I actually like to unstopper the drain first. And then I'm gonna hold the drain as close to the patient's body as possible. And with a little alcohol swab, I am just going to strip all of the contents of the tube into the bulb of the drain so that they do not clog up the tube, okay? Little clots and debris will form in the tube, and that's totally normal. And after we strip it, the tube will sometimes stay compressed, and that's fine. Just ignore it. Eventually it will puff up again. And then I'm gonna squeeze the bulb closed and stopper it. Okay, so I am just gonna unstopper the drain like that. And then I am going to squeeze the contents into whatever measuring cup is available. You can use a little plastic cooking measuring cup or a little specimen container like we have here that just has some measurements, which you really can't see here. All right. And then once you're done emptying it, you're gonna squeeze the drain and restopper. And that's it. A lot of antibiotic ointment, so very generous. This happens to be bacitracin. And then we are going to put it generously around the drain site, like that. And then I am going to take a clean scissors and take a 2x2 gauze, usually a couple, or this happens to be a 4x4 that I folded into quarters. And then I am going to cut it about halfway through like this. And then I am just going to tuck it up underneath the drain tube like that. And just put a little piece of paper tape over it to hold it in place. Patients who have implants, we use Mepilex, okay? All right, ready? Okay. So now I'm gonna demonstrate a drain dressing with Mepilex. And so we use this in patients who have implants, tissue expanders, or any other sort of prosthetic. So I will take the Mepilex, which I typically send home with patients from the hospital, cut it about halfway through, remove the silicone backing, put the sticky side towards the patient, slip it up underneath the drain, and then stick it to the patient's skin. In order to make it water resistant or waterproof, hopefully, so that they can take a shower, I will take a piece of Tegaderm, cut it in half, take one half, cut it halfway through, tuck it up underneath the patient, remove the paper backing, and then take the other half and put it right over the tube. That way, the dressing will stay water resistant so that she can shower and not worry about getting the drain site contaminated with shower water. Drain removal. So the most important thing to do first after we've stripped the drain is to remove all of the suction. So we want to make sure that the drain bulb is open and that the tube is not compressed. Otherwise, it's going to be uncomfortable for the patient. The next thing I'm going to do is cut her drain stitch. And there it is. Okay. And then we are just going to move 1, 2, 3. Ouch, 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 ouch. And that is it. And then we'll get some antibiotic ointment. We'll put a generous fingerful on the drain site, a little gauze pad, and some paper tape.